Tirzepatide, Zepbound, a new treatment for weight loss. Complete drug review. Hi again everyone, and welcome to a special edition of the PharmEasy Tutor. Today I'll be spotlighting the use of Tirzepatide for weight loss. This will be a concise review that hopefully will provide you with everything you'll need to know about the drug. Tirzepatide is a prescription medicine that helps adults with obesity or those who are overweight with weight-related medical problems lose weight and keep it off. The brand name is Zepbound, and it is manufactured by Eli Lilly and Company. Tirzepatide is a drug that mimics two incretin hormones in the body, named GLP-1 and GIP. By activating these receptors, hunger and appetite are suppressed. It is the first of what is called a dual agonist weight loss drug. Tirzepatide is administered as a once-a-week injection subcutaneously under the skin. Tirzepatide was first approved by the FDA to help control blood sugar in the treatment of type 2 diabetes in 2022 under the brand name Mounjaro. Zepbound has the same active ingredient as Mounjaro. You can see in the table that Mounjaro and Zepbound are the same drug, Tirzepatide. However, the indications for each drug are different, as Mounjaro is used for type 2 diabetes and Zepbound is used for weight loss. Note that the dose is the same for both drugs. Obesity is the most prevalent chronic disease worldwide. In the United States, over 70% of adults are obese or are overweight. 1 out of 3 adults, over 100 million people, have obesity. Treating obesity can improve blood pressure, blood sugar, and cholesterol levels. You have probably heard of the popular drug Ozempic being used for weight loss. However, Ozempic is not indicated for weight loss, but indicated only for the treatment of type 2 diabetes. Therefore, Ozempic is currently being used off-label for weight loss. Wegovy is FDA indicated for weight loss, but it may be less popular due to its higher cost. Ozempic and Wegovy share the same active ingredient, semaglutide. Now the drug Tirzepatide or Zepbound is a new player, being introduced to the growing weight loss market. Let's talk about the current injectable drugs being used for weight loss. Liraglutide was the first GLP-1 weight loss drug approved in 2014. However, it requires a daily injection, and the average weight loss of 5 to 8% was less than favorable. Ozempic and Wegovy share the same active ingredient, semaglutide. Ozempic is currently being used off-label for weight loss, and Wegovy is FDA approved for weight loss. Wegovy showed a better average weight reduction of 12%. Zepbound is the newest weight loss drug. Where Zepbound differs from the other approved agents is that it also imitates a second hormone called GIP. One weight loss drug that is yet to be approved is called retatrutide, which also works on glucagon. Tirzepatide is indicated for chronic weight management in adult patients with an initial body mass index (BMI) of greater than or equal to 30, obesity, or an initial body mass index of greater than or equal to 27, overweight, in the presence of at least one weight-related comorbid condition. BMI is calculated by dividing weight in kilograms by height in meters squared. Tables such as these are readily available to easily calculate a patient's BMI. If the value falls in the darkened area, the patient is overweight. If the BMI value falls in the lightly shaded area, they are obese. Tirzepatide should be used in combination with lifestyle changes, including a healthy diet, reduced calorie intake, and increased physical activity and exercise. Tirzepatide should not be used in combination with any other tirzepatide-containing products or any other GLP-1 receptor agonist. Avoid using tirzepatide with other products intended for weight loss management, including prescription drugs, over-the-counter drugs, and herbal preparations, since the safety and efficacy of co-administration has not been established. Tirzepatide has not been studied in patients with a history of pancreatitis or with severe gastrointestinal disease, including severe gastroparesis. Tirzepatide is an injectable GLP-1 and GIP receptor agonist. GLP-1 stands for glucagon-like peptide 1, and GIP stands for glucose-dependent insulinotropic polypeptide. Let's first talk a little bit about the incretin hormones GLP-1 and GIP. After eating a meal in response to the presence of food in the gut, the small intestine releases incretin peptide hormones. The two main incretins are GLP-1 and GIP. GLP-1. GLP-1 receptors are present in several areas of the brain involved in appetite regulation, in the brainstem and hypothalamus. GLP-1 acts centrally in the brain to suppress appetite centers, causing a loss in appetite and reducing food intake. GLP-1 also slows gastric emptying, how quickly food leaves the stomach, promoting a feeling of fullness, satiety, thereby reducing appetite and causing weight loss by eating less. In the figure, you can see how the stomach is communicating with the brain, telling it that it is full. The brain gives a thumbs up, telling the body to stop eating. Finally, GLP-1 stimulates insulin secretion and inhibits glucagon secretion, thus lowering blood sugar. What about GIP? GIP is the main incretin hormone in healthy people, responsible for most of the incretin effects. GIP further contributes to the regulation of food intake by reducing appetite, increasing sensitivity to insulin, and improving on how the body breaks down sugar and fat. GIP amplifies GLP-1's effects. Here is a diagram showing where GLP-1 and GIP works. GLP-1 primarily works on the CNS to increase satiety, on the stomach to decrease gastric emptying, and on the pancreas to increase insulin. GIP supports the effects of GLP-1, working in the CNS, pancreas, and adipose tissue. Now we can talk about the mechanism of action of tirzepatide. As we said before, tirzepatide is a GLP-1 and GIP receptor agonist. Tirzepatide mimics the two incretin hormones GLP-1 and GIP in the body by selectively binding to and activating their receptors. It is thus considered a dual agonist weight loss drug. Tirzepatide works by targeting and activating GLP-1 receptors in the brain that regulate appetite and control hunger. Here are the physiologic effects of tirzepatide. It lowers body weight through decreased calorie intake. The effects are likely mediated by affecting appetite. It delays gastric emptying, creating a sensation of fullness. The delay is largest after the first dose, and this effect diminishes over time. It lowers body weight with greater fat mass loss than lean mass loss. It stimulates insulin secretion in a glucose-dependent manner and reduces glucagon secretion. These effects can lead to a reduction of blood glucose. And finally, it increases insulin sensitivity. The starting dose of tirzepatide is 2.5 milligrams sub-Q once weekly. The 2.5 milligram dose is for treatment initiation and not for chronic weight management. After 4 weeks, increase the dose to 5 milligrams sub-Q once weekly. Increase the dosage in 2.5 milligram increments after at least 4 weeks on the current dose. The recommended maintenance doses are 5 milligrams, 10 milligrams, or 15 milligrams sub-Q once weekly. Consider treatment response and tolerability when selecting the maintenance dosage. If patients do not tolerate a maintenance dosage, use a lower maintenance dose. The maximum dosage is 15 milligrams subcutaneously once weekly. Here are some important administration instructions. Tirzepatide is available as a single-use injection pen. The dose is already preset and the pen is discarded after the shot. Inspect the syringe visually before use. It should be clear and colorless to slightly yellow. Do not use if particulate matter or discoloration is seen. Administer once a week on the same day each week at any time of the day, with or without meals. And inject subcutaneously in the abdomen, thigh, or upper arm. Rotate the injection sites with each dose. Missed doses. If one dose is missed, and it is within 4 days after the missed dose, administer Tirzepatide as soon as possible. If more than 4 days have passed, skip the missed dose and administer the next dose on the regularly scheduled day. If the day of weekly administration would like to be changed, it's okay to do so as long as the time between the two doses is at least 3 days. Tirzepatide is available in pre-filled single-dose pens of the following strengths: 2.5, 5, 7.5, 10, 12.5, and 15 milligrams per 0.5 ml. They come in cartons of 4 single-dose pens. Storage. Store the Tirzepatide pen in the refrigerator between 2 degrees Celsius to 8 degrees Celsius. If needed, each single-dose pen can be stored unrefrigerated at room temperature, not to exceed 30 degrees Celsius, for up to 21 days. If stored at room temperature, do not return it to the refrigerator. Store the pens in the original carton to protect it from light. Do not freeze and do not use if frozen. The pen has glass parts. Handle it carefully. If you drop the pen on a hard surface, do not use it. What about dosage adjustments for renal or hepatic impairment? No dosage adjustment for Tirzepatide is recommended for patients with renal impairment, including end-stage renal disease. And no dosage adjustment of Tirzepatide is recommended for patients with any degree of hepatic impairment, mild, moderate, or severe. How to use the Zepbound pen. Prior to initiation of Zepbound, patients and caregivers should be trained on the proper injection technique. Zepbound is a pre-filled pen for one-time use only. The dose is already set on the pen. Inject under the skin, subcutaneously only. The guide to parts shows a purple injection button on the top, a lock in the middle, and the gray base cap and needle at the bottom. Step 1. Choose your injection site. You or another person can inject the medicine in your abdomen or front of thighs. Keep 2 inches away from your belly button. Another person should give you the injection in the back of your upper arm. Change or rotate your injection site each week. You may inject in the same body area each week, but make sure it is not in the same spot each time. Do not inject into an area where the skin is tender, bruised, red, or hard. Step 2. Make sure the pen is locked. Do not unlock the pen until you are ready to inject. Pull the gray base cap straight off and throw it away in your household trash. Do not put the gray base cap back on, as this could damage the needle. Do not touch the needle. Step 3. Clean the injection site with an alcohol swab or soap and water. Do not touch the injection site after cleaning. Step 4. Inject Zepbound. Place the clear base on the skin, then unlock. Unlock by turning the lock ring. Press and hold the purple injection button for up to 10 seconds. Listen for first click, which means the injection started, and the second click, the injection is completed. You will know your injection is complete when the gray plunger is visible. Step 5. Disposing of your used pen. After your injection, place the used Zepbound pen in an FDA-cleared sharps disposal container right away after use. Do not throw away the pen in your household trash. When your sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your disposal container. For more information, refer to the following FDA's website. To find specific disposal locations in your area, go to safeneedledisposal.org. Absorption. Following sub-Q administration, the mean time to peak plasma concentration of Tirzepatide is 24 hours. The mean absolute bioavailability after sub-Q administration is 80%. Similar exposure was achieved with sub-Q administration in the abdomen, thigh, or upper arm. Distribution. The mean volume distribution of tirzepatide is 9.7 liters. Tirzepatide is highly bound to plasma albumin, 99%. Metabolism. Tirzepatide is metabolized by proteolytic cleavage of the peptide backbone, beta oxidation of the C20 fatty diacid moiety, and amide hydrolysis. Elimination. The primary excretion routes of tirzepatide metabolites are via the urine and feces. Intact tirzepatide is not observed in the urine or feces. Elimination half-life is approximately 5 days. Tirzepatide owns an amino acid sequence, including a C20 fatty diacid moiety that enables albumin binding and prolongs the half-life. Steady-state plasma tirzepatide concentrations were achieved following 4 weeks of once-a-week administration. Drug interactions. Insulin and drugs that cause insulin secretion. Hypoglycemia. Tirzepatide lowers blood sugar and can cause hypoglycemia. In patients with type 2 diabetes, tirzepatide caused hypoglycemia in 4.2% of patients, compared to 1.3% given placebo. Concomitant use with insulin or drugs that cause insulin secretion, like sulfonylureas, may increase the risk of hypoglycemia. Reduction of the dose of insulin or sulfonylurea may be necessary. Inform all patients of the risk of hypoglycemia and educate them on monitoring for signs and symptoms of hypoglycemia. Another drug interaction can involve oral medications. Tirzepatide delays gastric emptying and thereby has the potential to impact the absorption of concomitantly administered oral medications. Monitor the effects of oral medications concomitantly administered with tirzepatide, especially those with a narrow therapeutic index, such as warfarin. Another drug interaction can occur with oral hormonal contraceptives. The use of tirzepatide may reduce the efficacy of oral hormonal contraceptives due to delayed gastric emptying. This delay is largest after the first dose and diminishes over time. Patients taking oral hormonal contraceptives should switch to a non-oral contraceptive method or add a barrier method of contraception for 4 weeks after initiation with tirzepatide and for 4 weeks after each dose escalation. Hormonal contraceptives that are not administered orally should not be affected. To stay updated with each installment of the PharmEasy Tutor, make sure to subscribe to this channel. It's easy. Just click on the black subscribe button below to change it to the word subscribed. Then, to get notified whenever a new video comes out, click the down arrow and then select all. Also, if you like videos such as this, please take a moment to click on the thumbs up icon below to change the color to black. Thanks for your help with this. Contraindications. Tirzepatide is contraindicated in patients with a personal or family history of medullary thyroid carcinoma, MTC, or in patients with multiple endocrine neoplasia syndrome type 2, MEN2. This risk of thyroid seed tumors is an FDA box warning. In rats, tirzepatide caused an increased incidence of thyroid C-cell tumors at clinically relevant plasma exposures. It's unknown whether tirzepatide causes thyroid C-cell tumors, including medullary thyroid carcinoma, in humans. Counsel patients regarding the potential for MTC with the use of tirzepatide and inform them of symptoms of thyroid tumors, a lump or swelling in the neck, trouble swallowing, shortness of breath, or persistent hoarseness. There are several warnings and precautions to be aware of with the use of tirzepatide. Among them is severe gastrointestinal disease. In clinical trials, tirzepatide was associated with severe gastrointestinal adverse reactions, with an incidence of 1.7 to 3.1%, compared to 1% for placebo. Tirzepatide is not recommended for use in patients with severe gastrointestinal disease, including severe gastroparesis. In post-marketing experience of Zepbound, ileus, or intestinal blockage has been reported as an adverse reaction in the product labeling. Gastroparesis and ileus related to weight loss drugs have been recently in the news. In July of 2023, 3 women reported via the FDA Adverse Events Tracking System that they developed severe GI symptoms after receiving treatment with semaglutide injections. 2 were diagnosed with severe gastroparesis, stomach paralysis. In August of 2023, a woman sued Novo Nordisk and Eli Lilly, the manufacturers of semaglutide and Tirzepatide, alleging that the companies failed to warn patients of severe GI symptoms, including gastroparesis. The woman reported stomach pain, severe vomiting, GI burning, hospitalization due to stomach issues, and excessive vomiting. In September of 2023, following more than a dozen reports of intestinal blockages among people using Ozempic, the FDA added a new warning to the drug's labeling. Ileus, intestinal blockage, has been added to the post-marketing experience for Ozempic. Warnings for intestinal blockages for other popular diabetes drugs, including Wegovy and Mounjaro, already existed. Other warnings and precautions include acute kidney injury, which can result from dehydration due to tirzepatide's GI side effects, acute gallbladder disease, including cholelithiasis and cholecystitis, and acute pancreatitis. There is a risk for diabetic retinopathy with the use of tirzepatide, as well as the possibility of suicidal behavior and ideation. Serious hypersensitivity reactions such as anaphylaxis and angioedema have also been reported. Pregnancy. The use of tirzepatide during pregnancy is not recommended due to the risk of fetal harm caused by exposure to the drug and weight loss. Lactation. There are no data on the presence of tirzepatide or its metabolites in animal or human milk, the effects on the breastfed infant, or the effects on milk production. Adverse drug reactions. The most common adverse reactions reported with tirzepatide were GI-related: nausea, diarrhea, vomiting, constipation, abdominal pain, and dyspepsia. Other ADRs included injection site reactions, hair loss, and fatigue. Hair loss was reported more frequently in female than in male patients. In the tirzepatide group, 7.1% female versus 0.5% male, and in the placebo group, 1.3% female versus 0% male. This table shows that a large percentage, more than half of tirzepatide-treated patients, experienced some type of GI side effect, compared to 30% for placebo. The majority of nausea, vomiting, and/or diarrhea events occurred during dose escalation and decreased over time. However, you can see that only a small percentage of patients, less than 5%, require discontinuation of treatment due to the GI side effect. Clinical studies. The efficacy of tirzepatide for chronic weight management was studied in 2 trials named SURMOUNT-1 and SURMOUNT-2. SURMOUNT-1 was published in the New England Journal of Medicine in July of 2022, and SURMOUNT-2 was published in The Lancet in August of 2023. The studies were randomized, double-blind, placebo-controlled trials. The studies were conducted in conjunction with a reduced calorie diet and increased physical activity. Let's first discuss the SURMOUNT-1 trial. The study involved 2,539 adult patients. It was the larger trial of the 2. Subjects were obese or overweight with at least one weight-related comorbid condition. An important point was that patients with type 2 diabetes were excluded. The mean age of patients were 45 years, women comprised 68%, and 71% of patients were white. The mean baseline body weight was 104.8 kilograms or 231 pounds, and mean BMI was 38. Participants reported an average duration of obesity of a little over 14 years. Eli Lilly sponsored the study. Methods. Patients were randomized to receive tirzepatide 5 mg, 10 mg, or 15 mg, or placebo once weekly. The dose of tirzepatide or matching placebo was escalated once weekly during a 20-week titration period, followed by a 52-week maintenance period. The total duration of the treatment period was 72 weeks. After the 72-week treatment phase, a 4-week safety follow-up period occurred. Endpoint. The primary efficacy parameters were mean % change in body weight and percentage of patients achieving a greater than or equal to 5% weight reduction from baseline to week 72. Results. After 72 weeks of treatment, all three tirzepatide dosage strengths resulted in a statistically significant reduction in body weight compared to placebo. Subjects using tirzepatide at the highest dose of 15 milligrams lost on average 49 pounds, while at the lowest dose of 5 milligrams, subjects lost an average of 34 pounds, compared to 7 pounds on placebo. The average weight loss for study subjects using the highest dose of tirzepatide 15 milligrams once a week was 18%. In comparison, Wegovy, manufactured by Novo Nordisk, produced an average 15% weight loss. This figure graphically shows the percent change in body weight for all three strengths of tirzepatide compared to placebo. This is another diagram showing the study results seen at 72 weeks. Also, notice good benefits occurring as early as 24 weeks of therapy. More results. A greater proportion of subjects treated with tirzepatide 5 mg, 10 mg, and 15 mg achieved at least a 5% weight reduction compared to placebo. 85 to 90% of subjects treated with tirzepatide lost at least 5% of their body weight. Subjects on the highest dose of 15 milligrams achieved the greatest degree of weight loss. There's a 50% chance of attaining a greater than 20% loss of body weight if subjects use tirzepatide at a dose of 10 or 15 milligrams. Let's review the SURMOUNT-2 trial. A second, much smaller study was done to determine tirzepatide's impact on weight loss, specifically on subjects with type 2 diabetes. It was performed on 938 adult patients. Patients were randomized to receive tirzepatide 10 milligrams, 15 milligrams, or placebo once weekly. Patients who were using insulin or injectable GLP-1 receptor agonists for type 2 diabetes were excluded. The results of SURMOUNT-2 found that in people with diabetes who used the highest dose of tirzepatide lost an average of 12% of their body weight. This is compared to non-diabetics in SURMOUNT-1, where they lost an average of 18% of their weight. This data supports the theory that people who have diabetes tend to lose less weight with tirzepatide than those who don't have diabetes. Cost. The list price of Zepbound is $1,060 for a 1-month supply. Zepbound's cost is approximately 20% lower than Wegovy for weight loss, which runs at $1,349. Ozempic sells for about $900 a month. Mounjaro is set at just over $1,000 a month. Lilly is planning to have a commercial savings card program that will help people better access Zepbound. People who are commercially insured with coverage for Zepbound may be eligible to pay as low as $25 for a 1-month or 3-month prescription. People who are commercially insured without coverage for Zepbound may be eligible to pay as low as $550 for a 1-month supply. About 1/4 of private insurers cover the cost of weight loss medications. Government insurance, including Medicare and Medicaid, does not cover the cost, although federal employees, including members of Congress, now have coverage for weight loss medications. Here are some points of discussion to use when counseling patients on the use of tirzepatide. All of the potential risks were discussed previously. Here are some more patient counseling points of discussion. Here's the bottom line. Tirzepatide, Zepbound, is the latest FDA-approved injectable weight loss medication. It is the first dual agonist weight loss drug because it mimics two incretin hormones in the body, GLP-1 and GIP. In a large clinical study involving non-diabetic obese patients, Tirzepatide at a dose of 15 milligrams weekly demonstrated an 18% reduction in weight compared to placebo after 72 weeks of treatment. The dose of Tirzepatide must be slowly titrated upward to reach the target dose to reduce the incidence of gastrointestinal adverse effects. The cost of Zepbound is $1,060 for a 1-month supply. Patients who are commercially insured may be eligible for a discounted price. Is Tirzepatide worth it? Well, I have provided you with a lot of information, but everyone needs to decide on their own if the drug is worth the high cost. And while you're here, take a look at some of the other videos on my channel. Thanks for tuning in to watch this installment of the PharmEasy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share this site with someone else. Stay tuned to the PharmEasy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.